Hi, I'm Toya Brasky from Galveston, Texas, also known as Galveston Psychic Paranormal Researcher. So, I am coming on today to share my story about having major breast reconstruction only 5 days ago. So, I'm at 5 days post op, and I'm showing you the result of the surgery. So, overall, I want to show you that the breast size that was eventually picked is very proportioned to my body. So, you can see they're not grotesquely large, but they are very firm and very tight and very proportioned to my body. I had actually picked a larger implant, which was a high profile implant, but there was so much surgery that had to be done on my breast that they ended up choosing another size. So, let me just give you a background. When I was 20 years old, I had 2 lumpectomies for tumors that had roots that were growing into my rib cage. At that time, on my right breast, they scraped out tissue and also did 2 lumpectomies, which followed with my breast being uneven because of the tissue loss. So they did mastectomy implants. So fast forward, I kept the implants in my chest for 40 years. I only knew that there was a rupture because sometime at the beginning or end of 2024 in December, I started to have a weird leakage from my chest coming out of my skin, which led me to go into the doctor's office. I was afraid that it was breast cancer because my mother is a breast cancer survivor, but it made more logical sense that it was probably the 40-year-old mastectomy implants and they had probably ruptured. I was correct. I did have ruptures bilaterally on both sides, and also I had multiple masses in both breasts. That resulted in 2 biopsies, going back and forth to the physicians and surgeons and specialty surgeons in plastic surgery for over 6 months. It took a long time for them to figure out a plan of how to handle my case. So in the end, we decided on a total capsulectomy to remove the implants which were underneath my muscle that were originally put in my 20s. They were completely flat. I still had my own breasts, which were about this size, because I gained 50 pounds over the last year, and I actually weigh 200 pounds. I'm 5'8", so I carry the weight really well. So, I knew that I was going to have a capsulectomy, which that meant cutting me all the way from under the arms, all the way under each breast, all the way around, lifting that muscle, cutting through there, and taking out the capsules of the old ruptured implants, scar tissue, and silicone. So that's a major cut to my chest already. So, I needed a implant exchange because I did not want to just leave my breast hanging. I felt like, I've always had thick, dense breasts, thick, dense, round breasts, which run in my family. So my breasts actually looked okay. They weren't bad in any way. And I have very thick skin. But I had originally asked for a reduction from a D cup to a B cup, but I was told I didn't have enough muscle or tissue to do that. And so my only choices was either to go with no implant or to put another implant in to replace the ones that were taking out and to give my breast more fullness. So I didn't want to go extremely large. I just wanted something that would make me about the same size, but also to lift my breasts, because as we age, our breasts begin to go down, and my nipples were not bad. They weren't up here, but they were about here. So I knew that putting a large implant into the breast would probably be okay, but what wouldn't be okay is in about 6 weeks or later they begin to drop, which would mean that if my nipple was here, that large implant could pull my nipple down even further. So at first I resisted in every way having a breast lift, because I did not want the ugly vertical scar or the scars around my nipple where they actually cut around the nipple all the way around the complete circumference, and then they leave the blood vessels and nerves attached, but they move it up and then they reattach it, and you have a very ugly vertical scar here. I already knew I was going to have the complete scar all the way around on the bottom, so really the vertical scar was just something extra. So in the final consultation, even though I adamantly said I would never do the breast lift because I hated the vertical scar, when I did my case history research and I saw that augmentation alone would never move the nipple position, I knew that I needed a lift. So I agreed to the lift despite the fact that I hate the scar. So they were still at that time considering a mastectomy, a level 5 biopsy for my lymph nodes, because my mother is a breast cancer survivor and I still have multiple masses in my chest. I knew that I would need the capsulectomy, the breast implant exchange, and then what is called a mastopexy, which is the breast lift. So I actually ended up having 4 procedures on the same day. So they ordered 3 sets of silicone implants from the 500 range, 600 cc range, and 700 cc range. I had originally picked the 700 cc's because I wanted the most fullness in my breast, and I wanted high profile implants that were more frontal than round and flat. So they ended up ordering 3 sets. 2 were high profile. The middle one was kind of like a high profile but moderate implant. It was in the 600 cc range. The one that I really wanted, which was 700 cc's, was not picked so that I could have outrageously grotesque large breast. It was picked because of the measurement of my breast. When they measure your implants or measure your breast, they measure up and down vertically like this. They measure all the way across like this. And you have to have an implant that will fit the pocket that they cut. So after they cut the entire underneath part of my breast, and they pulled out the old silicone and capsules of scar tissue, then they sewed that up, and then they had to cut a pocket in my actual breast in the glandular tissue to put the new implants in. And then you have to understand that after they insert those implants, I also wanted a lift. So what they did was they did insert the 700 cc implants, but when they did that, there's no stretch in my breast. My breasts are so dense that they actually put the implant in, and there wasn't any room whatsoever to do a lift. It was so stretched out that they didn't have any room to make any revisions. So they took out the 700cc implants and they used two different 600cc implants. Because remember, I had said that I had a asymmetrical problem with my breast because of the prior surgery in my 20s. So they used a 675cc implant in my smaller breast here on the left side. They used a 635cc implant in my larger breast, which was okay. So they ended up evening out after 5 days. But initially, when I looked down at my breast after the breast surgery was finished and they showed me my breast, they looked so distorted that I was worried. I hated them. I thought, oh my God, what did they do? One was very, very massively swollen more than the other. Because of the swelling, they were pulled to the side horizontally. So they looked flattened out. You couldn't even see a cleavage at all. All you could see was this pulled out, like boxy look. And then the nipples were so distorted that even though they did a lift, my nipples were pulled like down here, like because of the stretch. It looked so crazy and so disappointing that I felt like crying after the surgery. Not only that, I was in so much pain. I had complications from the anesthesia. And I ended up being in massive pain where they had to give me Dilaudid twice. I ended up having reactions to the actual anesthesia. I was having trouble breathing. I was also vomiting repeatedly, so they hospitalized me. At that time, I had to have physical therapists help to shower me, to take care of me, and I did pretty well. Within the 24 hours, I recovered and they let me come home. I'm on about 9 different medications right now. Some are anti-capsulization medications so that I don't get encapsulated implants, because these are over the muscle. They are in my breast tissue, not under the muscle. So you have a higher chance of breast implant encapsulation if you put it in the glandular tissue over the muscle. But I like the more projected look, so I did decide to put it in the breast tissue rather than under the muscle. There's also a reason for that. Okay, if you are young and you get a breast implant put under the muscle, great. That's just like a push-up bra. You don't have any implant in your breast. You just have a big mound that sits underneath the muscle that pushes your breast forward. But the downside of that is, as you age, your breasts begin to droop. If you get pregnant or if you gain any weight, the outside breast over that muscle mound with the implant put under the muscles is going to stay exactly where it is, but your breasts are going to droop below it, and then you have this crazy, really unattractive, ugly, bizarre looking breast that you have a hump, and then you have breasts that droop underneath the hump. And I said, there's no way that I'm going to do that. Being 61 years old right now, I wanted to pick the implant that would give my breast the most fullness, that would lift my breast to a tightness that would not be grotesquely large, but would be attractively large. So, they're still going through a stage right now. I'm wearing a compression bra, and I have to wear the compression bra for 6 weeks. What I'm going to tell you is I still have significant pain, but because I am taking 9 different medications to combat pain, I'm doing okay enough to make this video. One of the things that I would like to show you is this is all the implant. And as time goes on, see, they are still swollen. They are still moved out to the side. But as the weeks go by, and even the months, it can actually take up to 6 months to a year before you see the final result of your breast augmentation, or of your breast lift. So at this time, you're still seeing them distorted, swollen out to the sides, but eventually they are going to be more, like more close together with more of a cleavage. They are very projectile. You can see in every way they are very projectile. What you're seeing here is not my nipple. This is bruising from whatever tool that they used. I have bruises all over my breast, around my nipples, stitches around my nipples, bruising up and down the vertical scars, and bruising all underneath my breast. It doesn't feel good. I haven't slept real well. I have to sleep on wedge pillows, elevated, for 6 weeks. Right now, my actual torso is swollen. There's fluid all in my torso. There is fluid in my neck and all in my chest. My underarms are actually swollen. I don't want to show you that. But what you're seeing is the real me. There's no filters on this. So at 200 pounds, this is my body. I would like to be a lot thinner. I used to be very, very thin like this. And I actually have a waist. My throat, if you hear me, is still sore from the airway tubes that they had down my throat for 6 solid hours during this 6-hour surgery. At times, the soreness in my breast feels very, very strong. As you can imagine, they were completely filleted underneath the muscle, then filleted again in the breast tissue, then filleted and cut all the way around the circumference of the nipple, split right here with tissue cut out and sewed back together. And then the implants are so large that they've got my skin stretched to the maximum capacity. So the pain feels like there is broken glass in my breast, and I can feel stabbing pain and sharpness in my breast and aching. I can't even do a lot around the house without having to stop and rest. I can't pick up anything for over 5 pounds. I cannot drive for 6 weeks because of bleeding risk. Right now there is tape and there is a cotton gauze underneath my breast, but there's no drainage tubes, thank God. So I just wanted to come on and let you know that I'm doing okay after the surgery. It was very, I guess, difficult to go through as a woman, because I didn't have ugly breasts before the surgery. I actually had pretty nice looking breasts. And to come out of surgery and your entire breast look like a patch quilt that they just patched together all over the place is a lot. But I understand that right now there is glue, there is invisible tape over those incisions. They tried to use the very smallest incision, like razor blade thin cuts that they could. Those scars can take up to a year to fade. But I decided that I don't have a single tattoo on my body. I mean, none. I've never really liked tattoos. I've never been the kind of person that wanted to tattoo my body in any way whatsoever. I'm kind of old fashioned. Like, I like to be classy. I like to not have tattoos. But it was so hard to make the decision to have the breast lift and to have that vertical scar that I had to research how women covered that. And I started seeing a lot of women that did have tattooing on their breasts after breast surgery to hide the scars. And as I was looking through these tattoos, there was one that just struck me as so beautiful. It was very tasteful. It was a very tiny vine of pink cherry blossoms that started at the nipple and then went down like a vine, and it was just very beautiful. And then a vine of the cherry blossoms under the cup of the breast. It was so tasteful and so beautiful that I really think that I'm going to find a tattoo artist that can do that for me, and then I will never feel self-conscious about the scars. What you're seeing is shadowing on my breast. So you can see that, I wanted cleavage, but I didn't want to look ridiculous. I didn't want to look like, animated and comical and obsessively, that kind of gross big boob look. I just wanted something that was healthy, number one, something that was proportioned to my body, that even if I lost weight, you can see that these do not look bad on me. At one time, I was a size 4 through 6. Right now, I'm actually wearing a size 14. So my waist, most of all, is large. But like I said, I'm 5'8", so I carry the weight very well. I don't look, giant and fat. Now my arms are flabby. I need to work on myself. I do know that. But I've been celibate for 17 years, so it's not like anyone sees my body except me. So you may ask, why was it important for me to get implants again? It was important to me because my self-image matters. And as a woman, I like to be curvy. I really like, I don't think that I would ever want to be a size 3 again. I've been a size 3 before. I've been a size 4. I was bone thin. I didn't like it. I look at women that on social media at a size 3 or 4, you look great because the camera puts on weight. But in person, sometimes I see these women that are 5'8", 5'9", 5'10", that weigh, under 140 pounds, and they're skin and bones, and it doesn't look healthy. I want to be healthy. I don't care about being bone thin, model thin. I just want to be healthy. I want to look, decent. I'm going to get a little closer to the camera. Right now I'm having issues making this video because I had to set up a bed in the living room because they won't allow me to sleep with my pets for 6 weeks until I completely heal. Don't let this fool you that I look okay for this video because, like I said, I'm taking 9 different medications to combat the pain, the swelling. This was quite a ordeal to get through this surgery. I really fought with complications during the surgery, after surgery. I can only do the minimal around the house. A part of me is so worried still. How am I going to make my bills? How am I going to survive this 6 weeks off with no pay? Really, it's devastation in every way. But I have had some help. I've had some neighbors go buy me groceries. I've had my brother and my sister come and bring me some things that I needed. I still can't bathe. This is why you see my hair like this. I'm not allowed to bathe. I can lightly shower and pat dry, but things like submerging my head in water, things like that, are things that I can't do. In fact, when I was in the hospital, physical therapy had to actually shower me and soak me down because I couldn't do it. That was kind of embarrassing. I've never actually let someone bathe me, but I needed all the help that I could get at that time. So, I'm not embarrassed to come on and show you this is my real body. There's no filters. This is how I look at size 14. I am a little bit chubby right now. Actually, my torso would be smaller, but they told me for several weeks I will have fluid in my neck, chest, and also my torso, because all of the fluid that is draining from my breast is flowing downward. So I may look a little chunky in this video. So I'm going to get a little bit closer because I want to show you some things. So hold on just a second. I literally, ow, 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 ow. It's hard to change positions. So let me get a little closer. So, I want to just be able to show you some of the things up close that you may not be able to see from far away. So, the shape of my breast is going to be extremely rounded in every way. They're frontal, they're also rounded, they're extremely tight. What you're seeing right here is not my nipple, it is bruises from the actual surgery tools that they had to use. Now you may ask, where is my nipple at this time? My skin is so skin tight, I can't even lift up my breasts with my hands. They are just molded on like super tight right now. So they tell me that it is actually normal, absolutely normal, that because of the tightness, and even though they did a lift of the nipple, my nipple is somewhere here right now. Maybe, well, I can feel it right here, yes. So my nipple is right here. It will eventually move up as the swelling goes down, and these implants will drop to the bottom more, causing the skin to move up to give a higher lift to my nipple. It won't change the size. In fact, actually, as the implants drop and as they drop from the sides, this is the reason that I have a compression bra on. You have to wear that compression bra because you need your compression bra to compress the sides of your breast, and the compression bra is actually moving the implants more to the center like this to give you the cleavage and that kind of rounded look over the breast that'll eventually happen as they come together. They are very large, but I had large breasts to begin with. They may be slightly larger than they were. This is okay with me. I like it. I like to be curvy. So, right now I have the compression bra that I have to wear for 6 weeks. I have several of them that I can change in and out. I'm sorry, my hair is just a mess. I can't wash it, like I said, unless I can stand in the shower and use a cup to pour a cup over my head. I can't lift my arms to really curl my hair or fix it right now. Basically, I'm not supposed to do anything with my arms. So basically, you're just seeing me at my, like This is kind of like my worst. Kind of like just dingy, not anything special. My hair is just thrown into ponytails because I can't do anything else. Even if I was to remove this bra right now, my breasts are just so hard and so swollen that they are just stuck in this position. Like literally, you can see the roundness of them. They're actually quite large. 675 cc's is a lot. So I don't know, the 700 cc's would have just been maybe outrageous. Maybe I'm glad that it worked out the way that it did, and I ended up with the 600, 635 and 675 cc's. And you may think that's weird, like one of my breasts is going to look different than the other. But actually, because of the tissue loss in one breast, they had to put a larger implant in that breast and then a smaller one in the other one, because anything can happen during surgery, and they have to be able to calculate. You might order two of the same implant sizes, but if you have to take out tissue, that could result in asymmetrical breast. So really there's only like a 40 cc difference in the two breast implants, but because I already had two different size breasts, it evened them out. So I'm glad for that. Anyway, this is just absolutely awful conditions to make this kind of video because I don't have any room. Right now I'm standing against the edge of the bed to try to get in here to get in the camera angle. It's very awkward. I don't like to do videos like this, but I did want to let you know I'm doing okay. The hardest thing is being at home and absolutely having zero things to do because I would like to be able to have something to do to entertain me, but there's really nothing I can do. I can't drive at all. I can't pick up anything over 5 pounds, so I can't do any heavy lifting. I thought, well, I'll rearrange all my drawers. I'll do all of that. The doctor was, don't even think about doing all of that. Leave it alone for the 6 weeks. Take your time to heal. And so I'm trying to find things on TV to watch. You may see me posting a little bit more on my page. I actually did something the last few days that might have shocked you. I had posted a picture of my surgery incisions on X. I actually had my hand over my nipple and I was just showing how bad the scarring was underneath the breast. So someone at X had labeled that adult content. Well, that made me upset because I was covering my nipple, my areola, in the first post, and I felt like talking about breast reconstruction for women is not an adult subject. This is something we should be able to talk about. So it made me so angry that I actually posted 2 pictures, one before and one after, showing my nipple out of spite to protest that they labeled my prior picture as adult content. So anyway, I don't feel bad about showing my nipple, my actual nipple before and after at age 61 because it's just a breast, and I'm showing it for the purpose of explaining breast reconstruction to you. Now, if I was posing provocatively, doing something sexual in the picture, then okay, label that adult content. You may want to label my breast Reconstruction surgery pictures as sensitive material if people don't want to see that. Sorry, my eyebrows are just all crazy. I feel just really, really, really completely undone. I can't stand feeling yucky and, not being able to take long baths, all of those things that I would normally do. I'm only at day 5 and I have to take 6 to 8 weeks off for recovery. Really, I may not look like I'm suffering. Remember, I'm on a lot of medication, but there are times of the day, many times during the day, I'm in absolute pain. I'm weak. I can only actually last about 2 to 4 hours, and then I have to go lay down again. I'm really exhausted. I don't like taking medications. I'm a person who never took a single medication, so I hate being on all these medications all of a sudden. But I think that everything is going to come out okay. The most important thing is I had to sign a release that if they did the breast lift and they cut around the nipple, that one of the complications of that could be necrosis of the nipple, where your nipple dies and rots off. It's a complication that absolutely can happen during this type of surgery. But I'm happy to report after 5 days, I have pink color in my nipple. They preserved the nerves and the blood supply to it. It's doing absolutely fine. It looks like it's healing. It has good color. And overall, on my entire breast, everywhere, the entire circumference of my breast, all the way around, and especially the nipple, I still have full 100% feeling and even some hypersensitivity in the nipples. So they were able to spare all of my nerves and blood vessels, and everything on the skin is completely sensory okay. So this is not the kind of video that's professional. I wanted to be able to come on here and I wanted to look cute, and I wanted to have styled hair, and I wanted to come on and maybe appear really attractive. That's not going to happen today. As I'm standing here, I'm sweating. My breasts are beginning to kind of like throb and ache from standing here too long. But I am okay. So you've seen what the result looks like at day 5. This is not the way that they will eventually look. Like I said, as time goes on, the weeks go on, there will be a process called the fluff and drop at about 6 weeks, where these implants will slightly move down. They're going to move closer. That's part of the reason that you have to wear the compression bra, because your compression bra needs to be tight enough to squeeze them like this, and they need to heal a pocket in that way. Otherwise, they're going to stick out to the side and they're going to look bizarre. So wear your compression bra. I don't care what all of those surgeons online say that are not using compression bras now. It takes a full 3 months for your breast to form a protective pocket completely around the implant to hold it in place. So remember, wear that compression bra. It's very important. So I'm doing all of the things that the physicians and doctors have told me to do. I have several surgery post-op visits, and I think I'm going to be okay. Good night. Bye.